And no, I think our care of patients with atherosclerotic heart disease and cardiovascular disease has really changed over the last few years. For many years, we were responsive to acute cardiovascular needs, and we still are. So somebody having an acute heart attack, we bring them to the cath lab, open up the artery. Somebody having an acute problem with their brain, having a stroke, we are now doing acute stroke care. Obviously, people with atherosclerotic disease in their limbs, peripheral vascular disease, we've been chronically caring for them. Occasionally, when they have acute problems, we care for them. Our care now has become much more preventive, and I think that's really an important aspect. So we focused on cholesterol and lipids, lowering those as low as possible. We've done antithrombotics and antiplatelets to reduce the risk of some of those thrombotic events. And we've spent a lot of time on the other comorbidities these patients have, ensuring that diabetes and other conditions are best represented. So I think about atherosclerotic cardiovascular disease as taking care of acute problems, but hopefully focusing on the prevention to prevent those acute problems across the broad spectrum of risk factors. As a cardiovascular doctor, I would say PAD is for a long time been the under-recognized, under-treated condition. We know that, almost 8 million Americans have peripheral artery disease, 220 million people around the world do. Yet when you have PAD, the likelihood of getting evidence-based therapies has been much lower than if you had coronary artery disease. So getting your cholesterol lowered, getting the right antithrombotic. What's helped us over the last few years is that we've had some new therapeutics coming out. Certainly most recently with the COMPASS trial, rivaroxaban 2.5 milligrams twice daily in addition to aspirin has been something we've demonstrated in patients with chronic PAD that reduces limb events. And until recently, we haven't had a lot of things that reduce the rate of somebody getting an amputation or acute limb ischemia event. And then I participated in the Voyager PAD trial. So there's more emerging data in those patients that we do these peripheral vascular interventions in that we can reduce their repeat limb events and repeat cardiovascular events. And so those include both the cardiovascular events we're used to, but also then acute limb ischemia or an amputation from a vascular cause, things patients really care about. So those are really exciting new therapeutics that I think are important for our PAD patients. And coming down the pipeline, I envision, again, therapies that are also pushing down cholesterol really low, potentially helping us reduce events in our patients with peripheral artery disease. I think the newest guidelines, certainly from the European Society of Cardiology, and I know the American Heart Association and others, the American College of Cardiology are working on PAD guidelines. The newest guidelines now highlight that single antiplatelet therapy used to just be with aspirin or clopidogrel was useful. Now they've added a guideline recommendation saying antithrombotic therapy with 2.5 milligrams of rivaroxaban twice daily on top of aspirin. And the European Society guidelines may be helpful for patients with limb events. And I think that's an important PAD recommendation. I also think that the guidelines will be addressing exercise therapy again, making sure we try to get our PAD patients to walk as much as possible. And there's a large randomized trial looking at endovascular versus surgical intervention for patients with critical limb ischemia called the BEST CLI trial. Hopefully results of that later this year in 2021 will give us information about some of the ways in which we can care for our patients with critical limb ischemia. An extremely hard year for all of us. And, I would just say for all the frontline healthcare workers and essential workers, we really appreciate everything people are doing for taking care of COVID-19 patients. What we've seen with COVID-19, and I live in North Carolina, where unfortunately there's a surge like many parts of the country, is that COVID-19's really changed how people come to deliver and get healthcare. And avoidance of healthcare is understandable, but many patients still are having heart events and cardiovascular events and limb events, and so they need to seek healthcare. And the second thing is that we really recognize the importance of caring for our patients with cardiovascular disease because they're at high risk in the COVID-19 pandemic. So making sure we monitor them and have ways with us remotely or through telehealth caring for them has been important. And finally, I'll say that patients with COVID-19 and atherosclerotic cardiovascular disease and limb disease are at increased risk for thromboembolic events. And so we've also seen that these patients can get clots, and treating them with either aspirin or anticoagulants has been something we've been doing that has now also been shown to be potentially helpful in these patients and is being studied. I think the two revolutions going on in atherosclerotic cardiovascular disease, if you will, are that for many years we were focused on the platelet. You know, the platelet was the center of sort of how a plaque ruptured and we got an atherosclerotic event. And for several years, we've known that inflammation and thrombosis play a key role. And the revolutions are that with newer therapeutics and technologies that really reduce people's cholesterols and their LDL down to 30s or 40s, we're able to really make much of atherosclerotic heart disease silent, or at least stop the progress. And the newer antithrombotic therapies that aren't just antiplatelet therapies, but antithrombotic therapies that are 10A inhibitors and using another pathway really are preventing some of the thrombotic events, not just in atrial fibrillation and venous thromboembolism, but now in vascular disease. And so these two sort of strategies at the biologic molecular level of pacifying the plaque and preventing from a thrombotic event are getting even better as time has come on.